Hi, dear Dr. Joy and dear colleagues. This is Reze Fekrazad from Iran. I have a presentation today, and I hope this presentation will be useful for you. First of all, I would like to have a special thanks from my dear friends Dr. Joy Diodore for his kind invitation and creating this opportunity that we can share our experiences in this summit. Second, I would like to mention I cannot give you a practical guideline and precise protocol. I just want to have an explanation of a new concept in COVID-19 management. COVID-19 has 4 months age, and there are a lot of unknown things about it. Please let me start my presentation on the slides. This is a short introduction of me for you. Albert Einstein had a famous dream. What if I could ride a beam of light across the universe? I try to show you in these presentations. We may be able to ride light photons across the universe of COVID-19. The topic of my presentation is how can photobiomodulation and antiviral photodynamic therapy help us to manage COVID-19? Main questions. I'm going to answer these questions in this presentation. Why do we think PBMT and APDT can help COVID-19 management? What's photobiomodulation and how can it help us? What's antiviral photodynamic therapy and how can it help us? What's the clinical considerations? I would like to clear that I don't want to ignore conventional treatment at all and say these methods are answer of all questions. I just want to improve our abilities with different methods, especially biophotonic and biophysical methods. We as soldiers for fighting disease need different weapons and value whatever can help us in this way. First questions. Why do we think PBMT and APDT can help COVID-19 management? Please let me come back to COVID-19 short introduction. I'm sure majority of you know about the structure of the new coronavirus. There is very powerful equipment around this virus. That name is spike protein. This is very important equipment of this virus to create pathogenicity for the human body. So this spike have a very famous receptor around the host cells with name angiotensin convertase enzyme 2, ACE2. These enzymes mostly expressed in nasal mucosa cells, bronch cells, especially lung cells, heart, esophagus, kidney, stomach, bladder, and ileum. So after interaction between this enzyme and spike protein, virus can enter to the host cell and damage the cells, and finally we faced with the injured tissue, for example pneumocyte type 2 cells in the lung involved with the virus and suffering from this virus. So what's our pathologic findings? The most important complication of this disease is acute respiratory distress syndrome, ARDS, and also our immune system act this injury, and finally we face elevation of plasma cytokine such as interleukin-6, interleukin-8, and one of the famous type is TNF-alpha. At the end we have cytokine storm. In this slide you can see the role of interleukin-6 is pathogenicity. The interleukin-6 secrete from different cells such as macrophage, dendritic cells, and monocytes. Finally, this interleukin-6 with hypersensitivity in immune systems, where we can face with the cytokine release syndrome. So current treatments focus on the antagonist of interleukin-6. These treatments may be one effective therapeutic intervention to solve COVID-19 problems in the human. So if I would like to summarize this pathogenicity, we face these problems in the body: hypooxygenation because of lung damage, fatigue in cellular levels and general levels, tissue damage, lung, heart, esophagus, kidney, stomach, bladder, ileum, and cytokine release syndrome, and finally spreading of virus. Unfortunately, there is no reliable treatment or vaccine for SARS-CoV-2 right now, and research centers are working on them. I summarized the different types of treatments in this diagram for you, but because of limitation of times, I prefer fast these slides, and you can follow these treatments in my slides in the PDF form in the website. In final, the recent treatments are focused on antiviral therapy, anti-inflammatory, stifling the cytokine storm, increasing tissue oxygenation, and tissue rehabilitation. I would like to add, we should open the door for everything which help us to improve above mentioned points. So, photobiomodulation. On the other side of laser therapy coin, in medicine, we have another phase named low power laser therapy, low level laser therapy, actually photobiomodulation therapy. If we go back to the nature, we find one of the most common example of interaction between light and chlorophyll chromophore, photosynthesis phenomena. We also have been used light in medicine during decades in different diseases such as jaundice, reduce the impact of the 1918 Spanish influenza pandemic, psoriasis, depression, brain injury, and skin tuberculosis, lupus vulgaris, treatment by Vincent Lamb. It's interesting. Niels Reiber Vincent laureate Nobel Prize because of this novel methods in around 1920. Low-level laser therapy or photobiomodulation therapy is a type of interaction between visible light, usually red, or near-infrared light with low energy density and tissue cells without thermal effect. The biomodulation effects of PBMT due to the function of photoacceptors such as cytochrome C oxidase, NADH, flavoprotein, and so on, and its effect on the respiratory chain can lead to reactions such as photophysical, photochemical, and photobiological in tissue. In cellular effects, we have three types of effects. We can classify these effects in three parts: primary, secondary, tertiary, in the molecular level, in cellular level, and finally in organ level. There are a lot of complicated mechanisms involved in photobiomodulations. I'm sure my dear colleagues in the other presentations have mentioned in these mechanisms enough for you, but because of limitation of time, I prefer past these mechanisms, complicated mechanisms. For example, my dear friends, Professor Tina Caro, 30 years ago, showed us different mechanisms in molecular and cellular levels for us. So finally, we can reach this phenomenon in the body with photobiomodulation therapy: cell proliferation, cell differentiation, cell migration, increasing of cell products, regulating the function of the immune system, reduce pro-inflammatory cytokines such as interleukin-6, interleukin-1, interleukin-8, TNF-alpha, increase product of ROS, reactive oxygen species, nitric oxide, adenosine triphosphate, ATP, and cyclic adenosine monophosphate, CAMP. If we back the complications we faced with coronavirus in the right side, we had hypooxygenation, fatigue. We can increasing ATP by photobiomodulation. We can solve fatigue problem in the cell levels. Also, tissue damage. We can repair this tissue such as lung with the cell proliferation, cell differentiations in the stem cell levels, and something like this. Cytokine release syndrome. You can see we reduction of pro-inflammatory cytokines such as interleukin and 6, interleukin 8, and TNF-alpha by photomodulations. We can reach cytokine release syndrome reduction. But we miss one thing. We cannot solve spreading of virus with photobiomodulations. I have a solution in the next slide for this complication. Please let me. Can we answer these questions now? It depends on your judgment. May you ask me, what's your evidence for this phenomena in photobiomodulation? There are a lot of literature, more in clinical and environmental and translational studies in the media, but I prefer to mention our group studies now. We want to answer these questions. How can we establish this result of the photobiomodulation effects in the body? So we did a lot of study in this strategy: systematic review, in vitro study, animal study, and human study in different phases of the photobiomodulations. We did some articles in pain management. I sent my PDF of my presentation to Dr. Joy. You can find these articles in the media, and if you will connect my emails, I put my emails in the last slides and first slide of my presentation. Directly contact me. I'm at your disposal to answer your questions and also share our group studies with you. And also, and other studies in pain management. It's not in the subject of my presentation. In soft tissue regeneration, we find very good results. In the connective tissue, in the dermatology and the oral mucosa, we did different studies. And also hard tissue regeneration, in the bone regeneration, in the rabbit and rat and the human studies, we try to find the effect of photobiomodulation. In stem cell therapy, we find very good results. Also literature review, different literature review. For example, I would like to have a short explanation about some of our team studies. At first, I want to talk about the effect of cultural mesenchymal stem cells with the bone marrow source with the scaffold and therapeutic laser on healing rate of articular cartilage defects in rabbit model. Here you can see harvesting of the stem cell from the humerus, from the bone marrow. And you can see here patella after reflection of the flap. Finally, we create critical size in this. You can see here critical size defect in the patella with the trephine. And we also use the special collagen type 1 scaffold with the stem cells embedded in this scaffolds and put in the defect, and finally closed and sutured the flap. And we did photobiomodulation with the special protocols by laser therapy. In histopathological evaluations, in macroscopic form, you can see clearly in non-laser samples and laser samples, we completely close the defect, and in non-use lasers, incomplete healing. Another study, we evaluate the effects of combined low-level laser therapy and mesenchymal stem cells on bone regeneration in rabbit calvarial defect. One more time, harvesting the bone marrow mesenchymal stem cells and embedded these cells in the bio-os material as a scaffolds and creating the flap, reflection of the flap, and create for critical size in the rabbit calvaria, and laser therapy, immediately laser therapy, and mark after suturing, mark the area for the next sessions of laser therapy. And after 48 hours, we repeat the laser therapy. This is the laser parameters we used for this study. We collect this protocol from the systematic review and our previous experience, wavelength 8-10 nanometers because of deep penetration in the bone, and 200 milliwatt power with the 0.2 milliwatt per centimeter square and 4 joule per centimeter square dose of fluency, the gallium aluminum arsenide laser diode lasers. In conclusion of this study, we find improving bone regeneration in the case sites. We did another studies in root development with a complex of the dentin and the bone and the periodontal ligament around the teeth for root development in immature permanent teeth in dogs. You can see in the conclusion of our study we mentioned with the limitation of this study, irradiation of gallium aluminum laser can accelerate the rate of dentinogenesis in apexogenesis of immature permanent teeth with MTA in dog. Here you can see laser therapy model, and in the radiography completely you can see close the root but laser therapy rapidly than the control group. In current studies, in this study under review, we evaluate application of adipose-derived stem cells and low-level laser therapy for alveolar bone regeneration in rat model. In conclusion, you can see we find significant alteration in osteogenesis, angiogenesis, and inflammatory modalities in rats calvarial defects following PBMT. This is our last systematic review. We reviewed the literature to find biologic response of stem cells to photobiomodulation in the wide range. We find these results, PBMT, may result in the increased production of Reze, and nitric oxide, ATP, and CAMP. Even we have good experience in nerve regeneration in animal and human and the cultural level, and also in spinal cord injury. Very good results we find with photobiomodulations in the human studies that published in 2020. You can see here in the first and second studies. And finally, daily, we had very good results and very dramatic results in treatment of the diabetic foot ulcers in our clinic. I would like to have a special thanks Dr. Kazim for the courtesy of this photo for me. Let's continue to answer the next questions. What's antiviral photodynamic therapy and how can it help us? Photodynamic diagnosis and photodynamic therapy. Photodynamic therapy is a kind of interaction between light, photosensitizers, and oxygen. In fact, the release of reactive oxygen species due to the interaction between light radiation and non-toxic PS that can be a product inside the cell or supplied from the outside environment, cause cellular apoptosis or cell necrosis occurs with minimal damage to adjacent tissue. Accordingly, one of the most important advantages of one of the most important advantages of the PDT technique is its dual selectivity function, meaning that both PS and radiation with a specific wavelength are selectively transferred to the target cell or tissue. As I said before, we have a very famous triangle: photosynthesizer, special photosensitizers, photon source, and oxygens is essential for these treatments. In this slide, you can see we use in the patients suffering from the cancer, and after injection of the photosensitizers, and after passing the incubation time, we have accumulation of PS in the tumor, and finally irradiated by right parameters and with the different laser parameters, and we can get fluorescence diagnosis, that name photodynamic diagnosis in malignant tumors, and we change the wavelengths and the other parameters. We can reach photodynamic therapy or tumor removing. In this slide, you can see different photosensitizer with the different absorption spectra in the fighting with tumor cancer lesions. And I put slides for you, just for your informations. We can use laser spectroscopy with the fluorescence effect to detection of the rapid detection of antigen base of the COVID-19 detections for the patients. We use laser technology in the name of laser spectroscopy for this method. We can use laser photodynamic therapy for detection and treatment of the atherosclerosis, and also in the mucosal disease. I would like to show you different applications of photodynamic therapy in tumor removal for the anti-inflammatory effect and also antimicrobial effects. This is my patient. She suffering lichen planus, and after biopsy and find this histopathological evaluations. This is the right lichen planus. I use the methylene blue with the specific concentration, and after incubation time, we use photodynamic therapy for the pro-inflammatory effect. And finally, you can see we can control the inflammation of these patients. You know better than me. In autoimmune disease, we don't have any treatment choice. Just we decrease the symptom of the patients. In photodynamic therapy, there is no side effects in kidney metabolisms of the drug and or the liver metabolisms. We don't use the chemical drugs. Just we use the photodynamic therapy for treatments in these patients. So I would like to continue my words about the another aspects and very important aspects of photodynamic therapy entitled antimicrobial photodynamic therapy. You can find different forms of different terms in the media and PubMed and Google. You can find these names for this method. Antimicrobial photodynamic therapy, also known as photoactivated disinfection, is a new type of treatment that can inhibit bacterial, viral, fungal, and parasites infection. APDT is also known as photodynamic inactivation, lethal photosensitization, photoactivated disinfection, or photodynamic antimicrobial therapy. And as mentioned above, the most important application of APDT is the treatment of multi-drug resistance infections, especially in bacterial infection. According to these mechanisms, you can see these slides, APDT fight with microorganisms or nanoorganisms such as virus. Evolved viruses are the most important group of viruses that are affected by APDI. The presence of lipid and protein structure in the envelope plays an important role in the possibility of PS binding to the virus wall, and the most important mechanisms for virus inactivation is protein damage. For these reasons, We believe APDT will evolve into an essential tool for infection control and become a vital part of the solution to the global antimicrobial resistance crisis. I would like to illustrate that the way in which APDT can be used to directly decolonize human epithelial surfaces, reduce the risk of hospital-acquired infections, improve viral prophylaxis, and improve patients. In this slide, you can see different sources of photons. We can use different photon source, helium neon, diode, argon lasers, LED, and also currently daily light for the different disease in the dermatologic origin. Here you can see different types of photosensitizer: methylene blue, toluidine blue, malachite green with a spatial absorption spectra 636 nanometer, eosine, erythrosine, rose Bengal in 517 nanometers. You can see here structural formula of methylene blue and toluidine blue, and also you can see here spectra of absorption of the eosine, erythrosine, and also TBO and methylene blue. This is my favorite photosensitizer, radiocolorin in Russian med. I have the first experiences 15 years ago to inhibit ester mutans, the main pathogen in the caries in the oral cavity. We used the first time this drug for the antimicrobial photodynamic therapy. This is the absorption spectra of the radiocolorin and around the 630, and structural formula of the new drug. I would like to invite you to pay close attention for this drug. This is the very useful photosensitizers for the COVID-19. I have a good explanation about this drug. We did a couple of studies in our group about antimicrobial effects of photodynamic therapy. Because of the limitation of times, I would like to mention some of them in the next slides. So, if I would like to summarize the current studies focus in the PubMed and the media, you can see new modalities of the PDT in the medicine. Intravenous photodynamic therapy or a systemic photodynamic therapy. You know, in the photodynamic therapy, conventional photodynamic therapy, we focus in the local area. But in these methods, we can radiate the whole body with the special missions, and also in the blood radiations. Even you can find this, you can find very good studies in the leukemic patients suffering, leukemic patients, improvement with the intravenous laser therapy, and antibacterial effects, also antiviral effects. Low intensity photodynamic therapy, good point of these methods is we can use photodynamic therapy for photobiomodulation applications. It's interesting. We had a good experience in this fields. Currently we work on this method. And selective targeting by monoclonal antibody with minimal damage of healthy cell. new photosensitizer with different penetrations of the wavelengths, and because it's important for us, we have a very important points in the conventional photodynamic therapy. Since 30 or 40 years ago, the special photosensitizers used in conventional photodynamic therapy, we had the very short wavelengths, absorption spectra, and we found very good result in superficial lesions. But we had the major problems in the deep lesions in the body. So we need new photosensitizer in these fields for deep penetration of light. And we can treat deep organs in the whole body. And also another beautiful applications of photodynamic therapy is combination of these methods with nanoparticles in combined nanotechnology and photodynamic therapy in management of cancer and infection disease. You can see here we have very good fluorescence drug and the nanoparticle and antibody. We can selectively target the tumor cells for detections with the fluorescence drug and photodynamic or the photothermal therapy, not photochemical interaction with the cells, and we can destroy the tumor with this method. I prefer past these parts, but I would like to invite you. We wrote a chapter in this prestige book, the nanostructure for antimicrobial therapy. The title of our chapter is Antimicrobial Photodynamic Therapy with Nanoparticles versus Conventional Photosensitizers in Oral Disease, that published in 2017 as the Elsevier publisher. And also another chapters in another book in 2017. Our chapter title is the application of lasers and nanoparticles for the treatment of cancer originated from epithelial tissues. In this chapters, we discuss about the nanoparticle combined with the lasers to management of the epithelial tissue originated cancers. In the before chapters, we talk about the nanoparticle antibacterial therapy effect of nanoparticle and lasers in the infection disease. So, current application of APDT in viral disease, the main focus of our speech. The clinical initial applications of APDT as a potentially effective and safe treatment modality for infectious disease were directed against superficial viral disease, including herpes genitalis and herpes simplex and also HSV and human papilloma virus. And also the area of blood product decontamination with the antiviral photodynamic therapy. There is a very good study with the Canadian and also Brazilian researchers cooperate together and publish their results in 2019 in Nature Communications journal. They use photodynamic therapy to lung transplantation. You can see in this photo, they use red lasers before suturing these organs in the recipient patients, used for the decontamination of the organs with the two methods, with the blue light and photodynamic therapy. I give you a short explanation. A new biophotonic technique for the decontamination of organs before transplantation using ultraviolet and red light radiation has been developed by Brazilian and Canadian researchers. According to Magnato, the head of the Brazilian group, the technique was initially developed to treat lungs, but is being adopted for liver and kidneys. Dr. Chippel, the head of the surgical groups in Canada, they mentioned the new technique significantly reduced transplant organ viral load in 8 of these patients. During perfusion, while the researchers make the liquid circulate in the lung to be transplanted, they add molecules to the lung tissue, and biophotonic decontamination takes place directly in the organ through radiation with red light with a wavelength of 616 nanometers until photodynamic oxidation eliminates the microorganisms in the tissue. At the same time, the viral load is flushed away by the circulating liquid, which is continuously decontaminated by ultraviolet irradiation with a wavelength of 254 nanometer. The ultraviolet radiation directly destroys microorganisms by breaking down the molecule present in bacteria and virus. The bacteria are killed and virus are completely inactivated. Red light radiation decontaminates indirectly via photosensitizations. Please close attention. Here we had the target open the light, but in the body there is a different story. I put another studies for you about the blood decontaminations. They use another types of the photosensitizers. Porphyrins base can give us good results, better than methylene blue. In current studies, I would like to give you some studies about SARS-CoV-2. In these studies, the Chinese researchers published an article. They mention these results. BX1. The BX1 is a treatment, is a system designed by the Chinese researchers especially, and they use photodynamic therapy for the inactivation of virus in blood in their studies. They found BX1 can effectively eliminate SARS-CoV-2 within 2 minutes, and the virus state decline can reach 4 or 5 log 10 faced with the expanding epidemic. BX1 is safe for blood transfusion and plasma transfusion therapy in recovery patients, and the inactivated vaccine preparation has great potential for treatment in the current outbreak. Especially for this method, we can use in another applications. This group developed by vaccine biotechnology development groups Ltd has proven that inactivation of enveloped virus such as HIV-1 in plasma has high efficacy without damage to other components in the plasma and proved safe and reliable in clinical trials of HIV treatments. As I mentioned, this group have a very good result in control of HIV, so they repeated these methods for the SARS-CoV-2 virus for the decontamination of blood. So let me continue my speech. There is very good articles. They used riboflavin, vitamin B2 with the UV light to the contamination of the blood products. In the MERS-CoV, the same coronavirus, in the SARS-CoV-1 and SARS-CoV-2, they find very good result with this interaction between riboflavin and the UV. They use suitable wavelength for this methods, UVA and the blue lasers with the 440 regions. Just we use this protocol indirectly to blood in outside of body, maybe in the future in the body. So in continue, I would like to give you in another models. We found very good articles in the 2020 about the curcumin nanoemulsion associated with the photodynamic therapy in viral cell lines transducing different variant of HPV-16. They find very good results. They mention in the conclusion, this drug delivery system associated with photodynamic therapy may become promising in the treatment of vulva lesions. Maybe we can use this drug in the nano-sized curcumin, very cheap photosensitizers for treatment of the antiviral photodynamic therapy. This is the main problems of the photodynamic therapy. This the cost is high. In this methods, we need cheap and safe and effective photosensitizers in the population, the normal populations. Common application of APDT we can use in the final. I would like to summarize my speech. Antiviral therapy in line with the difficult access to deep target. We face these problems in the photodynamic therapy, and we can use these methods for MOF the contaminations, especially in the preventive effect of these methods in the early stage of the coronavirus disease patients. And we can use these methods in plasma therapy, and even we can use in the dental use. Before starting our operation in dentistry, because of my specialty, I would like to recommend my dear colleagues, before starting, we can use antimicrobial photodynamic therapy, antiviral therapy in this area in the near future, but we need search and studies about the cheap materials for the dental use. So I would like to mention our studies. We did 4 years ago studies in the children. We evaluate effect of antimicrobial photodynamic therapy on the counts of salivary streptococcus mutans in children with severe early childhood caries. You can see here very good results. APDT seems to be efficient to reduction salivary streptococcus mutans immediately after treatment in children. But we had two side effects. But the children are afraid from the discoloration of the oral cavity with methylene blue. And the parents said us they had discoloration in the urine until 24 hours later. So in the future, maybe we can use curcumin in these fields and other drugs and other photosensitizers. Maybe we can solve these problems. And so this is an opportunity we can use in the adult patients without this side effects, maybe. I would like to present, as I mentioned before in my slides, ICG-based photosensitizers, in my opinion, is the good opportunity for antiviral photodynamic therapy, because the absorption spectra of the ICG is 8-10 nanometers. It's a very good wavelengths for deep penetrations of the beam. We can use these methods in the deep lesions. Recent experimental and clinical studies have relevant that APDT is an effective approach for treating pulmonary infections. Researchers Geralde evaluate the efficacy of APDT with ICG as a photosensitizer, and extracorporeal is important things. In outside of the body, illumination using an infrared light source with a 880 nanometer laser device for the treatment of pneumonia in an experimental mouse model. The penetration depth of the light is the main limiting factor in widespread clinical acceptability of APDT in the case of deeper and thicker lesions. Among the photosensitizers, the absorption peak of ICG is in near infrared, where penetration into tissue is higher because of low absorption by water hemoglobin and melanin, which makes ICG an ideal photosensitizer in extracorporeal APDT applications for deep tissue lesions, which needs light penetration through the lung parenchyma. This is not a study about the lung treatment, but I would like to show you we can use this phenomenon in the other applications. In this study, they used ICG to photodynamic therapy against a liver tumor. You can see here they found very good results for inducing apoptosis in HCC. Clinical application of APDT. Therefore, a best use of APDT in clinical application, it's necessary to pay attention to all factors which is compatible with the mentioned elements. The manner in which the photosensitizers of APDT are transferred includes using lung environment, intertracheal and intravenous pathways. It has been demonstrated that these delivery routes of photosensitizers can homogeneously expose all affected areas in the lung without complications. However, the poor penetration of photosensitizers activating light through to the target tissue is also the other limitation of the clinical use of APDT. According to the recent clinical trial, APDT can be used at the oropharynx in subclinical infections in upper respiratory tract. in mouth and in nose. This method will help to reduce the microbial load and infection complications. What about the antiviral photodynamic therapy as a biophysical chemical treatment modality in SARS-CoV-2? In final conclusion, in this method, I can say you APDT can be applied in combination with other therapeutic modalities for SARS-CoV-2. Especially in SARS-CoV-2, we can use intravenous laser therapy, which is emitting the light directly to blood for decontamination of blood. Addition, photosensitizer accumulation in the lung tissue after intravenous injection of the agents and emitting suitable lasers from outside the lungs or inside the bronch can be useful. I have good explanations in the next slide about the technique. The possible agents is considered to be indocyanine green-based photosensitizers with wavelength of 8-10 nanometer for deeper penetration. At last, further clinical trials are recommended. Most best points of this wavelength is 8-10 nanometers we can use in the photobiomodulations also. Because of this, we don't need two different equipment for photobiomodulations and photodynamic therapy. We can use both wavelengths with the different energy density for the two applications. One more time, can we answer these questions now? Antiviral photodynamic therapy can help us to management of photodynamic coronavirus disease. It depends on your judgment. One more time. The last part of my speech focused on the clinical considerations. We have old and very important problems in photodynamic therapy and also photobiomodulations. Deep penetration of the light and scattering of beam, phase, decreasing of the efficacy of this method. So I have a classification for the methods of irradiation. Photosensitizers and other things is another story, but just I would like to talk about our classifications. In clinical methods, I have this classification: direct method, indirect method. I suggest this characteristic index for all methods. Effectiveness we mark with E, capital E, with 1+ low effectiveness, 2+ high effectiveness. Invasiveness I, no invasiveness I alone, low invasiveness 1+, and high invasiveness 2+, and risk of transmission for the virus I showed with the R alphabet. With low risk of transmissions I show with R1+, and 2+ for high risk of transmission. So in direct therapy, if we want to directly irradiate the lung, we can use intratracheal with a special diffuser and fiber optic in the intertracheal. This method is effective and invasive and high risk of transmission. Direct therapy in blood, we can use intravenous laser therapy, directly irradiate the blood. this method is the same considerations, characteristics, index, E2+, I2+, and R2+. In indirect therapy, we indirectly irradiate lung. I named transthoracic PBMT. I got these names from the transcranial PBMT. They had very old history. In transthoracic PBMT, effectiveness is low and invasiveness is 0, and the risk of transmission is low. We can use another methods in interstitial methods. I'm sure majority of you familiar with these methods. Because of limitation of time, I don't have good explanation about this method. Effectiveness 1+, invasiveness 2+, and the risk of infections 2+. In direct blood therapy, we can use transcutaneous laser therapy in wrist, back of knee, thymus, spleen, kidney, lymphatic nodes for the directly irradiation of the immune systems and immune organs in this method with the low effectiveness and no invasiveness, and finally low risk of transmissions. And another models is transmucosal models. We use sublingual artery in the nasal mucosa and rectal mucosa, and you can see here we faced these methods. We organized an E2+, 1+, A+, sorry, and low invasiveness and risk of transmissions is high in this method. In this slide, you can see different wavelengths with different colors in the IV lasers. Just want to show you some models. Laser acupunctures have a very good story, but not these presentations. Thymus therapy with the immune targeting systems. You can see here all organs of immune system we can irradiate by lasers. Lymphatic systems therapy is another branch of the photobiomodulations. They have a lot of research in these fields. And whole body irradiations. We can irradiate the whole body for both applications, both methods in photobiomodulation and photodynamic therapy. At the last, I would like to show you the transcranial photobiomodulations with the Hamlet, very special and developed equipment in these fields. So I recommend in the future we use the jacket form for the coronavirus patients. So I put this study for you. This group use extracorporeal equipment for the irradiation of the lung with the indocyanin green ICG and infrared light sources. They found very good results even in extracorporeal use. They use custom-made illumination devices. You can see here irradiate the rat and extra outside of the body. I know you asked me, this is the very small animals, but in the human is a difference. But I have some solution for this question. The next slide. I strongly suggest we use prone position for the laser therapy. You can see in this good slides that the physicians recommend the prone positions because the prone positions, because of gravity, the exuda and the water and the liquid in the vertical line part, and in the dorsal part you can see we have very good and clear area of the lung. So for laser therapy we can have access very good bulk of the lung, but the supine models we have limitations, and also there is no lipid or water to absorption of labelins. So we can reach suitable doses to treatment of the lung in this position. I strongly these methods. And also you can see when we use in the supine model, we have a barrier named heart. In prone model, we don't have heart as a barrier to radiate it of the lung with the laser. So in the supine model, I strongly use laser in between the rib radiations. We can touch by hand, and a little bit pressure, we put the small handpiece in this area. In this slide, you can see a different model in intratracheal laser therapy with a spatial diffuser for lateral radiate of the lung with the laser therapy. Another solution for the deep targeting, I think we can use high intensity laser therapy. Currently in physiotherapy, our colleagues use these methods for the radiation, but there is no enough evidence for this method. So my dear friends, Professor Laxo had a special presentation in this summit he has. So we review the articles and published in 2020. You can see in conclusion, we find high-intensity laser therapy may be an effective non-invasive agent in the management of musculoskeletal pain. Also, we can use these methods for the for future research to solve these problems I mentioned before. In final future aspects of photobiomodulation and photodynamic therapy. As I mentioned before, to manage the damage to the lung and other organs, we can use laser to oxygenation, photobiomodulation to oxygenation and rehabilitation of this tissue, and controlling of the cytokine storm. And after that, we can use photodynamic therapy, antiviral photodynamic therapy, to reduce spreading of the virus. So what's the problem of these methods? I would like to mention we need right parameters in clinical study. There is no clinical study in the SARS-CoV-2, so we need optimize the parameters in animal studies and clinical studies. We can use these methods. I recommend in preventive method for early stage of disease, and also in high-risk patients, heart disease, respiratory disease, immune-compromised patients. We can use 3 or 4 sessions to prevention of these patients to the COVID-19. And also we need some studies about using these treatments in which phases of disease. For example, in primary, in severe, in ICU patients. In maybe we need 10 to 12 sessions to treatment of these patients. We can evaluate before and after this disease. And there is important things. We use biophysical signaling in the body without low interaction with the chemical drugs. We can continue chemical drugs because of ethical point of view. We don't have any problems. I recommend use in combination therapy with the drug, and for example remdesivir, favipiravir, and something like this treatments. We can adjunct therapy. I recommend strongly we use this method as a combination therapy in these phases. Maybe in the future we can name this method as an alternative for the conventional methods. So we need equipment development. I mentioned before, in the transcranial laser therapy we have very developed equipment with the helmet form for brain injury. I recommend, if we want in the same time the whole of the lung, we should design a jacket form and piece for these patients. In photodynamic therapy, we need different photosensitizers with the different parameters, and we can use monoclonal antibody. Of course, this is the maybe we need a more cost for these methods, but the patients suffering with the that is a suitable methods. We strongly recommend nanoparticles combined with the suitable parameters laser therapy to antiviral photodynamic therapy in the photothermal therapy. You know, in photodynamic therapy, conventional photodynamic therapy, we strongly need the oxygen. But with nanoparticle, maybe we don't need the oxygen because we have the photothermal therapy. Unfortunately, I don't have time to talk about this, but the deep cases and the area we have limited oxygen, I recommend nano photodynamic therapy is a good solution for these patients. And another new modalities in the photodynamic therapy is sonodynamic therapy. Sonodynamic therapy, because of deep penetration in the body, can use for activation of chemical agent and control the disease by sonodynamic therapy. Maybe for the in future we can use this method for the solving the problem of the COVID-19 disease. In final conclusion, according to mechanisms mentioned earlier, we are referring to the capability of PBM and photodynamic therapy. The best use is a combination of both methods. As mentioned earlier, the present treatments are focused on viral removal, tissue oxygenation, and reduction or inhibition of cytokine storm caused by severe inflammation. With the combination of these two methods, we can achieve these goals with minimal interference with pharmaceutical methods and battle this disease with biophysical agents. Of course, in the future, the use of different modality of PBM and APDT can be evolved, and by using monoclonal antibodies, we could target lung tissue specifically. It can even be improved by using nanotechnology, making new photosensitizers in nanoscales and pasting them to the target tissue to obtain better results. I would like to invite you in our next chapters. We are writing a chapter named Photobiomodulation and Antiviral Photodynamic Therapy in COVID-19 Management, in book title Advances in Experimental Medicine and Biology, Springer publisher. In near future, we publish this 53 pages chapters. We can time to explain a lot of things here, more than 200 references. with a big group helped me to write these chapters. And if you will send me your request by email in the future, maybe share this chapter with you in the future. My presentation is finished. I start my words with the rhyme of Einstein, and I would like to finish a famous quote from late leader of India, Mahatma Gandhi. He had a famous quote, "My life is my message." Everyone would love to play a useful role to solve the problems of human during their life everywhere. So I wish you all a long life with a great message for humankind. Thank you for your kind attention and have a nice time. One more time, I would like to have a special thanks for my dear friends, Dr. Diodore, for creating this opportunity. I can share my experience for you. Have a nice time.